the average person touches a grocery store far more often than a doctor's office. And they trust their pharmacist. I can stand here and confidently say that we have a great trust from the patients that we're serving. And so I don't think that the impact that a pharmacy or a grocery store can have on health outcomes is fully recognized. We actually are the front door to health, and we've been underusing it. And so we've really been trying to find ways to bring that to fruition.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we have the Flava of the week about Withings launching its clinical care service. How can it benefit someone who owns a body scan or blood pressure cuff? And what is it indicating in the market as we see more companies move from health monitoring to medical care? I'll talk about that. Then Angie Nelson, VP of Pharmacy at Hy-Vee, shares how retail, pharmacy, and providers are working together to shift from sick care to prevention, how grocery retailers see themselves as the front door of healthcare, and how they're moving the needle with food for health initiatives. I'm Jared Johnson. Let's get it.
Flava of the week.
Withings could be providing us the latest blueprint for connecting preventive health monitoring with medical services. Most people know Withings for smart connected health devices, including their OG body scan, other smart bathroom scales, hybrid smartwatches, and at-home blood pressure monitors. On July 9th, the company marked a turning point by announcing the launch of Withings Medical, a new clinical care service for Medicare-eligible members. The service will operate under CMS's new Access model, the initiative designed to pay for outcomes in chronic disease management. So at launch, Withings Medical will focus on cardiovascular and metabolic health, beginning with hypertension, diabetes, and obesity. The market's quickly seeing the value of the company's new direction. The combination of consumer hardware and clinical care is generating interest because Withings already has devices in people's homes, giving its clinicians a potentially valuable stream of blood pressure, weight, body composition, ECG, and other data between traditional appointments. It's also being seen as an early test of whether consumer health companies can become true care providers. What's the consumer lens? Pay attention to the trend here. This move from monitoring care to delivering care. In Withings' case, care is delivered by a dedicated clinical team that builds an individualized care plan for each member. According to a press release, this team prescribes and adjusts medications as conditions evolve and supports day-to-day lifestyle change, all designed to integrate with the member's existing primary care team. So if they can successfully do that and bridge the gap between what we monitor and when we need medical attention, they're essentially solving one of preventive health's biggest problems, and they really can be onto something, in my opinion. I also wonder if usage will increase in the other direction, if consumers will use a body scan or a blood pressure cuff more often if they know that it can connect them to care services. Either way, this is just the latest example of how consumer devices and clinical care are integrating, which makes you wonder just how long before it becomes the norm and we see widespread adoption. Let's see how quickly users adopt Withings Medical and whether the market can learn what it takes for consumers to trust and value services that connect their proactive routines with care when they need it. That's another way that we'll build the healthcare of tomorrow. And that's the Flava of the week. Hey everyone, let's get to the flow. Please join me in welcoming our guest this week. I'm here with Angie Nelson. Angie's the VP of Pharmacy at Hy-Vee. And when I was hearing her speak at the Nourishing Change conference, I was really interested in a lot of I think the word that came to mind was collaboration. And so I want to hear about collaboration between different sides of the industry that are coming together to help make healthcare more preventive. And with that, Angie, I want to welcome you. Thanks for coming to the show.
Thank you for having me. I appreciate the opportunity to talk to you today. Collaboration is really important. It's kind of part of my job duties here at Hy-Vee. I'm a pharmacist by training, but I get to oversee all of our retail pharmacies, and I get to work with our retail dietitian team. So I get a little bit of collaboration in my day-to-day responsibilities.
That was actually going to be one of my questions is, how closely you are to some of the nutrition and dietitian, sides of things. So that's fantastic. I know that'll inform our conversation today. But let's help our listeners get to know you a little bit better. If you had to boil down your philosophy about healthcare, kind of help us understand like where you're coming from or maybe what a core belief might be about healthcare that you have.
Wow, that's a really great question. A couple of core beliefs I think for me is health is really a foundation, not a destination. So healthcare exists to give people the capacity to live their lives, but not just to fix the broken parts. And that's where we focus a lot on. So that's an area of passion for me. The shift is really from that treating disease to really supporting that whole person. So their nutrition, their daily habits, their access to care. I think those are all important pieces. And those are things that we're trying to incorporate into healthcare here at Hy-Vee. Food, pharmacy, and clinical care are not really what we want to be separate silos, but really connected to the entire outcome. I think another important thing for us here at Hy-Vee is that care should really meet people where they are. So we want healthcare to be affordable. We want people to be able to reach it. So we're really embedded into the communities. And so we feel like that's a great way for us to reach the patients that we're helping to serve. And they need to be able to trust care. And so in our pharmacies, we've had over 55 years of serving the communities. And for our retail dietitian program, we've been serving patients for over 25 years. And that really helps us with the engagement of the individuals we're serving. We look for ways to utilize that relationship to really make the healthy choice the easy choice. So whether it's offering vaccines in those communities, really becoming that trusted provider with the ability to walk in and make it easy for them, or it is utilizing our food health score to make a decision in the aisle. We just want to make sure that healthcare is easy for an individual to navigate.
One thing I really respect about that is the thought of about making the healthy choice the easy choice is that's typically not very easy for health care. Like by the time we are needing an intervention, a treatment, even just a diagnosis of something, by the time you get into a care setting, most of that journey hasn't been easy for the most part. And so being able to look at the parts where retail and pharmacy and grocery and, some of these other pieces of the puzzle kind of fit in with health and wellness, it's fantastic. And I love that as a philosophy here. When I'm looking at the pharmacist's role in that particularly, what are those opportunities right now for pharmacists to be part of that in terms of becoming more active partners in prevention and wellness?
Yeah, I mean, we've been doing it in some ways for many years, whether it's with vaccines and even just some of the adherence services. But we're seeing those patients on a very regular basis. They're seeing their pharmacists way more than they're seeing their primary care providers. So we see things, we see maybe slips in memory or challenges managing medications earlier on in the process than a healthcare provider, a traditional healthcare provider would notice because they're not seeing those patients on a frequent basis. Another great example of how pharmacists can really be interjective is because we have the ability to perform CLIA wave tests in all of our pharmacies. So we can help with some of that monitoring early on in the process and have access to that. Today, as a pharmacist, we have no lab work really unless we're performing it ourselves. So that interoperability that is available between other providers doesn't really exist for pharmacies where we don't get any of that back in. And so there's opportunities today where we can make a difference, and there's even greater opportunities where we can have influence moving into the future.
Fantastic. Yeah, those are bigger opportunities. And I do like highlighting the role of the pharmacist in all of that. Now, I want to kind of shine a different spotlight on the role of the pharmacist because that was one of the main roles or audiences that I saw at the Nourishing Change Conference, which is, again, where I was able to hear you speak on stage, as well as, get to know just kind of I feel like the community around what Nourishing Change was all about. And one thing that I enjoyed when I spoke with Jim Kirby from Kroger was about how this is not just a conference. He wasn't the only one, saying this clearly, but he was reiterating it about how it's a movement, how this wasn't just a one-time conference. I'm wondering what stood out to you, what ideas and conversations are still coming to mind and kind of, the things that you took away from the conference this year.
Yeah. First of all, I think the energy around Nourishing Change was just phenomenal. especially as the host, bringing everybody to Des Moines to visit. I thought it was so interesting to see how people were engaging, whether it was the panels when we brought different groups together or whether it was just the conversations that were happening. The emerging brands brought a lot of conversations and excitement to the area. But I would say two key things that I thought were really key points is really on the bringing the focus back to the patient. So as I think back to the keynote speakers from Amy Gleason and Danny, they both kind of said the same thing in way different messages. So Amy was talking about the challenges with her daughter and the 51 portals to manage and how bringing agency back to the patient so the patient could really have the focus of the care. And then Danny came up on the stage and talked to us about hospitality and his whole philosophy around services and hospitality, where service is that technical delivery and hospitality is really on how you make the person feel. And I think that those two tied together perfectly because it's putting the whole theme of the conference together into that focus back on the patient, but with different angles. And I think that's what Nourishing Change is all about. It's really making these commitments and having these conversations and then doing it year round to make a difference and impact the health outcomes of the patients. This is unusual to see two competitors, grocery competitors coming together to collaborate and host a conference. That's unheard of. And I think those type of conversations we're having throughout the entire conference.
Yeah, I saw that too. I saw the collaboration. I thought that was interesting. Again, like you said, the two hosting organizations. But this is what we need to see more of. And it's one thing that stuck with me and why
no
the
one can
conference
do it
was.
alone.
And I think we've had a lot of, we can point to a lot of attempts at doing it alone and seeing where that gets us. So
Yeah.
that's very true. When I think about the Hy-Vee side of it in particular, I'm aware of a lot of investments that Hy-Vee's made in integrating health and wellness and clearly retail experiences. What lessons are you learning? You mentioned about meeting consumers where they are. That's one of your philosophies here. What lessons are we learning, or Hy-Vee that is learning here? About how to do that.
Yeah, I would say I kind of touched on this before. The average person touches a grocery store far more often than a doctor's office, and they trust their pharmacist. I can stand here and confidently say that we have a great trust from the patients that we're serving. And so I don't think that the impact that a pharmacy or a grocery store can have on health outcomes is fully recognized. We actually are the front door to health, and we've been underusing it. And so we've really been trying to find ways to bring that to fruition. And so whether somebody picks up a prescription, that's a moment. That's a moment where healthcare can happen. Or they're stopping to make a choice between two items in the aisle. That's another moment. And we can do things by signage in the store. We can do things by our clinicians in the aisles. We can do things to really impact healthcare throughout the year and not in just those big moments or those big doctor's appointments.
What can we do to help, I guess, help healthcare understand the opportunities here? Because that's what I see. I see it as opportunities. I see it as a value of collaboration. I see different sides coming together here. How do we spread the word about it?
Yeah, I think that, well, it's a new way of thinking. It's really from that prescription to pantry type of thinking where you think about the entire patient and their entire journey. So one of the ways that we are thinking about it is opportunity GLP-1s has kind of given us to highlight how we can impact that entire journey. So yes, our pharmacists can fill the prescriptions, and yes, we can help educate on managing side effects. And yes, our dietitians can help educate on managing side effects, but also the nutritional needs from that medication. But we can also merchandise and make it easy for a patient to navigate and just tie our healthy groceries into that whole journey. I don't think there is a better example right now in healthcare where we can show how you can have that entire patient journey than at a grocery store, retail, pharmacy.
Yeah. So how are you seeing that move the needle? Like when you're talking about, I think especially on the nutrition side of things, how, we get retail and pharmacy and grocery coming together. Like how does that move the needle?
Yeah, I have a great example, if you don't mind me sharing, about a health plan that we partnered with. It was about 500 patients. It was a managed Medicaid population. So they're little bit harder to get engagement with. And we partnered with the plan. They provided us patients that had an A1C greater than 8 or no A1C on file, but they were on a diabetes medication. And so we got this list of patients. We sent them, we partnered with a fintech partner. So they were able to provide them benefits sponsored by the plan. So the plan provided them health benefits loaded onto a card that looked like a MasterCard or Visa card, like any old credit card. But what it did was it would only allow them to purchase healthy products. So that would be produce, lean proteins, a very curated product list that was designed to help them improve their health outcomes. And so we loaded benefits, sent it to the card. They would get $40 per month, but they could also earn additional rewards. One is just by doing a pre-nutrition survey and a post-nutrition survey. So it was a 6-month pilot. So we wanted to know what they knew at the beginning and what they came out of the end of the pilot knowing about their nutrition and their disease state. And on top of that, we also were able to give them dietitian visits. And within the 6-month period, they could get up to 4 visits and they would get a $20 reward that they could use right there in the aisle. So can you imagine having a dietitian visit and then getting to go out and utilize what you just learned in the aisle, or having the dietitian there with you in the aisle, making those choices? I think one of the things that we forget is that some of the best choices for us don't have any package labeling. And so it's really interesting to have to try to navigate that when you're trying to learn a new disease or just learn about how to engage in healthcare in general. And so we were able to really make an impact. We also were able to give rewards for an A1C. So A1C at the beginning of the study and an A1C collection at the end of the study. You'd get an additional reward. And so all those work together to really get those patients engaged in their health care. So for this pilot population with the Medicaid plan, we had 65% of the patients engaged, which is 33% higher than this health plan typically sees for any of their programs. But what was even more impactful was 83% of those patients ended the 6-month program compliant with an A1C in a compliant range. So that was extremely impactful. And the knowledge that they gained from their pre-post and the confidence that they gained was night and day difference.
Wow. Okay. Yeah. So that number, we need to shout that from the rooftops, kind of a thing. But that also, not to be understated, this was with a Medicaid managed care plan. Like, that's not easy to do either.
It is not easy to do. It's a very transient. We didn't have contact information for a large portion of the patients. So it was a challenge, but we really were able to utilize our relationships, our pharmacists. They trust, if they have been engaged with our pharmacists, they trusted them. And so that also helped with our engagement as well.
Well, what I'm hearing is not only like what's possible, because I do think this is more social proof, right, of what can happen. And we need to hear more of this. I can see on the healthcare side, on the provider side too, just opportunities as they hear and become more aware of things like this, because of the constraints that a lot of them do seem to feel, right? And I've come from the provider and health system background in my past, and so I can speak a little bit to the financial constraints that 9 times out of 10, the provider just feels like, well, I don't blame me for the system, kind of a thing, in terms of like why aren't they able to help with more preventive measures when they want to? Like, the vast majority of medical professionals went into the field to help people live healthier. And so they would like that. But most of that is not in their hands to be able to control or do anything with. So when I hear how things are able to move forward and see results like that, I mean, it's amazing. I wonder how we have retail and pharmacy and even health plans kind of work with providers to keep making this shift. Like, how do we build on this momentum, and how do we start seeing healthcare take on more of that ability to focus on the preventive side and just kind of build on the work that you're already doing?
Yeah, I think one exciting way is what you hit on earlier, and that really is that the Nourishing Change Conference is just a time for all of us to come together and meet together and collaborate in person. But we really want to keep that movement going throughout the year. And so we're forming advisory groups to really come together, form work groups together, and provide ways to collaborate and really impact change.
Nice. Okay, so this really is a movement then.
It
It's
is
not.
absolutely a movement. It is not meant to come together and just have those conversations once a year. It is meant to really be working and making actual changes.
You mentioned briefly, but previously you mentioned GLP-1s. I just wonder where they fit into this equation at any point. Like where you see them, either playing a part or ideally benefiting some of these changes that we're seeing in people. A lot of the changes that we're talking about are gradual, but we're hoping that they help people, see themselves in a better light, because that's the first step to be able to make those healthier choices on a day-to-day basis. Where does that all fit into the equation?
Well, one thing that I think GLP-1s, I just was talking about how it ties everything together and kind of gives us the perfect case study for how we can work together. But I really think what it's done is it has caused so many more individuals to become more aware of their health, be more aware of what they're consuming, take more agency in their overall health outcomes, and ask more questions. And so I think those are all great things and support exactly what we're talking about here, really focusing on that preventative side.
There seem to be still pretty strong feelings, I would say, about GLP-1s, but it's interesting. Like at the conference, I spoke with Mike Dabrowski from SciFox Health, and he was basically sharing this thought that, like as we're getting more evidence that yes, these things do save, like they reduce costs, they save time, they save money. And, it turns out these have been available long enough. We can see the evidence in some ways of how, as you do reduce the disease, that there are other benefits, other tertiary ancillary benefits to your health that come from it, whether the initial reason for being on a GLP-1 was metabolic management, weight reduction, or whatever it is. And so, again, I know it's not that simple, and I'm not trying to make it sound simple, because there's a lot of data on it, but it's just interesting to see like the conversations that we can have with more data and more evidence to support them, and just come to a better understanding overall of how something like a GLP-1 does fit into this whole this movement, if you will. Let's project a little bit here, because this has been super helpful. I think what you've done is truly open our eyes of what's possible, what's happening now, but how retail and grocery and pharmacy really all do come together. So let's say we're there at the conference, we're at Nourishing Change 3 years from now. Like, what progress do you hope we're talking about there on stage?
Well, I would hope that we would have better interoperability so that patients do have more access. I think we're at the cusp of some really great things there to have patients really be more engaged in their health outcomes. I would hope that pharmacists would be providers, and so we would be able to be even more impactful to the outcomes of the communities we serve. There's no other provider that is accessible as a pharmacist. We have a lot of pharmacists in rural communities that are underserved, and I just don't think that we are utilized as the clinical asset that we are in the healthcare system today. So I think there's a lot of opportunity for pharmacists to do more. So I hope we're bragging about all the things that pharmacists is doing to improve health outcomes. And I hope the attendance has quadrupled, if not tenfold, the amount of people coming to the table for the conference and also to join the movement and really impact change.
Well, I'll echo that, and we'll do our part here on this show to invite healthcare to represent itself, health systems, hospitals, and other medical groups and others to play their part in representing themselves there as well. So thanks for everything you're doing to make healthcare more consumer-centered, and thanks for joining us on the show today.
All right. Thank you for having me.